Hi, my name is Catherine Elliott. This is Shayla Campbell. We're going to demonstrate abduction of the carpal metacarpal joint of the first metacarpal, the thumb. So just to describe the joint a little bit, it's a saddle joint located here, and it's formed between the trapezium and the base of the phalanx of the first metacarpal. The movement occurs in the oblique sagittal plane. So I'm going to actually have you demonstrate the movement. Perfect. So she is already in the start position. Her elbow is supported, the wrist is in neutral, the fingers are relaxed. I'm going to stabilize her hand by my fingers being on the outside of her hand. My thumb will be here. The axis of the goniometer is going to go between the base of the first and the second metacarpal. So that's where the goniometer goes. The stationary arm is stabilized in the longitudinal axis of the second metacarpal, and the movable arm is along parallel to the longitudinal axis of the first metacarpal. So I'm going to have you come back to neutral. Now what's important to realize is in this position I am not in zero. My goniometer is already reading 15 degrees. So you note the initial position and you subtract it from your final. So I'm going to have you move. Beautiful. Okay. And I'm getting a reading of 55. Normal is 70. So now we're going to do passive. Okay. And now I'm going to gently take you out. Beautiful. And now I'm getting a reading of 100. That's 100 minus 15. So that would be 85. And that is beyond the normal limit. Now, functionally, what this relates to is grasping. So if Shayla was not able to open up her thumb, she would have a hard time doing a palmar grasp or a cylindrical grasp. So I'm Catherine Elliott, and this is Shayla Campbell, and we're going to demonstrate opposition in terms of how the thumb relates to the little finger. So I've set Shayla up in the test position. Her arm is resting comfortably, the forearm is supported, and her hand is open. And I'm just going to ask you to bring, and I'm just gently stabilizing on her wrist, I'm going to ask you to bring the thumb, the pad of your thumb to the pad of your little finger. Beautiful. And that's normal opposition. Okay, if there is anything less than that, what you would do, so I'm going to ask you to open up, and I'm going to ask you to go, halfway. Great. So if your client is in this position, the way you would measure the range of motion is that you would take the ruler part of your goniometer, and you would measure from the center of the tip of the thumb to the center of the tip of the little finger. And she is at 5 centimeters, and you would record it that way.
Hello, I'm Shayla Campbell, and I'm going to be doing the metacarpal phalangeal joint. And the purpose of the range of motion is to measure the amount of range of motion in the joint. And the joint I have is the MCP joint, and this joint is a saddle joint, and it's in the frontal plane. Okay. Now we're going to have Cathy's already in the start position. She has her elbow at 90, has her forearm straight, and then she has her wrist in neutral. And what I'm going to do is to stabilize the metacarpal, is so, and we're going to have our goniometer axis on the dorsal aspect of the metacarpal, and we have the stable arm parallel to the metacarpal joint. And what we're going to do is get Cathy to do some flexion. Flexing now. Okay. And what it's reading is 54. And that was the active range of motion. Now we're going to do the passive range of motion. I want to just move down just a little bit. And now it reads 70. And the normal is 50 degrees. Okay? And now we're going to do the interphalangeal joint, and that's a hinge joint in the frontal plane. And we see that Cathy's already in the start position with her wrist in neutral and her elbow flex. And we're going to stabilize the metacarpal and the proximal phalanx. And what we're going to do is have the stationary arm on the dorsal aspect of the metacarpal. I'm going to make sure this goes to 0. Okay. And we're going to have the goniometer on the metacarpal joint. Metacarpal and the proximal phalanx. Okay. Now we're going to ask Cathy to flex that joint. Okay. And with our active range of motion, we have 52. And now we're going to do passive range of motion. And we now have 76. And the normal range is 80.